When it comes to hair transplant, we tend to seek absolute answers to our questions. We ask the doctor questions like, is hair transplant permanent? Is the donor permanent? Hair transplant results last a lifetime. But doctor, I heard that Finasteride, if you take the drug, there will be no more hair loss. Or doctor, I heard that without Finasteride, I will not have a successful hair transplant. Well, this is so wrong. There are patients who without Finasteride have had absolutely miraculous results. And there are more patients who without Finasteride have not had a good result. And there are patients who with Finasteride continue to progress further. So there is no absolute answer to queries in hair loss and hair transplant. The only thing that a hair transplant surgeon can assure you is a safe hair transplant using the best technique, and he can assure you that in most of his cases the hair grows well. Well, that is the only thing a truthful hair transplant surgeon can tell you. Nothing else. There are no guarantees. Every patient is different. You show me a patient and I will show you what I can achieve. I can also tell you how he is likely to respond to the procedure. I can also tell you whether he will be able to tolerate Finasteride or not. But seeking one answer for every query in absolute terms is being very unfair to your surgeon. Now, like in this case, young patient in his late 20s who came to me a few years back and who for his grade 3 male pattern baldness received around 2200 scalp grafts. He was religiously on Finasteride and has been taking it even now, but his baldness continued to progress. It is not that if you continue to take Finasteride, your baldness will stop. It will not. Finasteride blocks only about 73 to 75% of your DHT. It does not block all of your DHT. No medication can and it shouldn't, because DHT is of use in many other bodily functions. So we do not block all of DHT. So despite the fact that a patient is taking Finasteride, his baldness is bound to continue further if his baldness is not stable yet. And this will happen more in patients who are young. Like in this patient who was a young patient who came to us early in his hair loss timeline. We did a procedure with about 2200 scalp grafts for the hairline and temple points. Nice result, but his temples continued to recede further. His native hairline received a setback which was gradual over a period of 1 to 2 years. So he came in for a minor touch-up. So you can see the result. The result of the previous hair transplant is maintained. There is no dilution of the result that he achieved, the result with which he is happy. Well, that's why he's come and flown into us after a 36-hour long flight. And you can see his very natural looking result, Caucasian hair transplant result at the end of about 18 months. He is still on Finasteride and continues to be on Finasteride even now. He has had no side effects with Finasteride. So for those of you who feel that Finasteride is not making any gains for you, I would just like to tell you that please try and stop Finasteride for about 3 months and see for yourself. Well, on that note, I end the video. Thank you for watching and God bless you.